We are getting an update today on respiratory virus season. Dr. Steve Threlkeld, an infectious disease specialist with Baptist Memorial Healthcare, is here to discuss the latest rise in RSV and flu cases. Thanks for joining us today.
Great to be with you. Thanks.
Tell us about some of the cases that you're seeing right now and who is being impacted the most.
Well, unfortunately, we're seeing a lot more cases. That time of year is hit. Colder weather, the holidays, our behaviors are changing, more inside gathering with families, and then some resistance to some of the viruses out there with COVID. So we're really seeing a resurgence in all three of those viruses. RSV and flu make up kind of a bit milder illness frequently than COVID in terms of hospitalizations and deaths. COVID still makes up about 8 times death rate of what we see even in flu. But as every year, these diseases typically have the biggest impact on the extremes of ages and those with already underlying medical problems, heart and lung problems, cancer, immune suppression, those kind of things. But it's affecting everybody for sure, at schools, at work. So we're seeing a lot of cases, which we always do this time of year. And we think of influenza-like illness, or ILIs, what the CDC calls it, because you don't test everybody. And it's based on the number of people that go to doctors' offices or come to hospitals with sort of consistent respiratory infections, cough, shortness of breath, and congestion, that sort of thing.
And can you talk about the symptoms of these viruses, and how can you tell the difference between RSV, flu, COVID, and the common cold?
Yeah, unfortunately, it can be quite difficult. Particularly with RSV and the flu, because there's just so much variation from person to person. We always used to say that the common cold, and RSV frequently causes kind of a common cold in adults. In little kids, it can cause a significantly larger problem with airways and croup sort of things. But respiratory syncytial virus in adults frequently is more like a cold, and the flu can be a milder illness in some too. So you really have to test to know that, to know the difference. So it can be difficult. So it really is important for people not to go to work or to gatherings, particularly where they're immunosuppressed or older people around, if you have an active respiratory illness, and to wash their hands and kind of avoid transmission. But it can be quite difficult. And of course, we do have home COVID tests, but not really for flu or RSV. So it can be quite difficult to know the difference without being tested.
So if you have symptoms, when should you go to the doctor to get tested? Or if your symptoms persist for how long, when should you go and get checked out?
Yeah, I think the largest part of it is how severe it is. If you're short of breath, you should always seek medical care, because that's a sign that things are worse, either because of your underlying medical problems or because of a more severe version of the disease. Flu tends to be more of that sort of situation than RSV or other common cold sorts of viruses. Those are the big problems with high fever, any kind of significant or worsening cough and shortness of breath. That's the time to check for medical care and to seek with your doctor or go to the emergency department to begin with. And then with COVID, obviously, if you're older particularly or have underlying medical problems and you do a home COVID test that's positive, they're excellent if they're positive. They sometimes miss it, but if they're positive, you can be pretty certain of that. And in those situations, if you're a person with some underlying medical problems, you should check with your doctor to see if you're a candidate for the medications that we have out there. Paxlovid, there's an IV remdesivir that you can sometimes get in outpatient infusion centers. And those medications, if taken early, can really decrease the severity and likelihood of hospitalization or death from COVID. So those are the main things that you think of when you look at those infections at this time of year.
And you just mentioned about decreasing the severity of some of these illnesses. How can people protect themselves from these viruses and prevent falling ill?
Yeah, absolutely. And an important thing, of course, is the old-fashioned hand washing. Washing your hands and not shaking hands with someone and touching your face or scratching your nose. That's an important way to avoid all kinds of respiratory infections, from the milder common colds to the flu and RSV as well. COVID, unlike a lot of those things, can jump a little bit across the room at you. So in those situations, it's helpful not to be in the same room with someone with COVID. You can still wear a KN95 or N95 higher level mask. For example, if you're in an airport at this point, at this time of year where the numbers have really gone up, once you get on the plane, actually the numbers are very low. The airflow is so high that there's not much COVID transmission. But if you're in a crowd of people and you're really worried about COVID, then one of those higher end masks would be necessary to protect you. From a lot of the other things, really hand washing goes a long way toward protecting you against those respiratory viruses. And also, if you're sick, it's important for you to be careful and wash your hands and try not to be around people who are at highest risk for those infections.
And can you talk about the vaccines, the flu vaccine, the RSV vaccine, and how effective they are?
But those two vaccines appear to be quite helpful, and particularly the flu with long-term data, very safe, very effective, and it keeps those people, particularly the highest risk folks, older or underlying medical problems, to keep them from getting as sick from the flu.
All right, we thank you so much, Dr. Steve Threlkeld, for joining us and updating us on respiratory virus season.
Thank you.